small groups both days. The projects you decide to work on today will be the same projects that you'll finish up through tomorrow. So with that, I'm going to hand it over to Stephanie, and let's just kind of get us warmed up in a conversation.
All right, if you want to go ahead, a couple slides there, Dave. So before we get started into the actual conversation, if you could just write in the chat pod, what is a planning session you have been a part of, whether you've been lead or just participated in it, but let's get some ideas in the chat pod here of what are some planning sessions or events that you've been a part of. And Angie, if you'll help read those out of the chat pod when they come in.
So we've got Senior Day drive-through, community scavenger hunt this summer, health fair, currently working on a nonprofit to combat homelessness in DeQuinn, mental health community connect, COVID drive-through testing, health block party, a ton of strategic planning. Outside of CCC activities, one is a large annual music festival, school card campaign for our nursing home.
All right, and you can keep them coming in if you, oh, there's some more.
Well, there's a bunch coming in. Food giveaway, vape talks, community block party, hospital telemedicine program. A lot of planning going on here. Community health events, planning to be a hero, wear a mask campaign.
All right, lots of good things going on. So when you think about those things that you're planning, and I see story time with Santa and telehealth, when you're thinking about these, and you can just go ahead and use your, you can raise your hand in your picture, you could raise your hand on your screen, or you can just kind of unmute yourself. We'll see how that goes. But what do you remember about those, what that went well? What was working for you when you were planning those events? Or participating, what was going well in the process? Amy.
One thing that seemed to go well in planning any of the things, and there have been a lot of different hats where we've planned everything from festivals to banquets or anything. And I know this sounds very basic, but writing down things that we talk about, even little notes or referring back to debrief notes from the previous year when things were fresh about what worked and what didn't work, to try to eliminate some of the hiccups we may have caught the previous time.
Thank you, Amy. Jennifer.
To echo what Amy was saying, and I'm a horrible note taker, and to identify somebody to take said notes during the meetings. I find I'm not great at actually participating in a meeting and capturing what was happening. So identifying somebody to take the notes, and exactly what Amy said, I want to say Amy all the time, the two M's, it really throws me. What Amy was saying in terms of then a wrap up and coming back and here's what worked well, here's what didn't work well, here's what we would change for the future while it's still fresh in your head.
We have in the chat box, community participation, joint partners' willingness to participate.
So when you think about those events that you've planned, what was frustrating for you? What was challenging or frustrating or difficult? Christian.
Well, for the drive-through testing, our biggest concern was just getting people to actually come. It was really hard to really try to promote. You know, we promoted as much as we could, but it was like we did it at 2 of our clinics, and then we did it at a local high school. So when we did it to one of our clinics, they were very hesitant to come. The participation was very low, but we were still able to get, you know, quite a few tests in. And the hospital that we partnered with to do this, they were kind of a little upset that we didn't have a lot of community participation. But I think that just kind of came from just the lack of promotion. that was kind of the lack of marketing. So that was kind of our big concern. So when we did it at the high school, we really pushed it. We used social media, we used the radio, and then we really had like over 100 tests were done over 2 days. So, you know, we saw it was a negative, but then it turned into a positive. So just the marketing was a difficult thing for us. And I'm complete.
Thank you. Jennifer and then Selena.
So what I think is frustrating and kind of difficult, that's something I've been dealing with already this morning, is the follow through of people in your committee, in the group, and relying on the people. So it kind of goes along with what I was saying earlier in terms of, I assume you mean it's not just taking over and doing it, but it's engaging them and encouraging them, your partners or whoever's in your group, to keep moving forward. And that's something I struggle with, is helping them stay on task without being a micromanager / bossy person.
Thank you, Selena.
I think that we can all relate to this at this point, but just trying to like make group decisions virtually, or like trying to like, because you know, not everyone can talk at once. So I think it's just, and then like you're fighting to talk and then you cut each other off and like you don't mean to, or two people start talking at once. So in our last board meeting that we had for this nonprofit, we're in like the paperwork stage. So there's a lot of like input and planning that's going into it. And so I think it's just learning how to navigate doing virtual meetings, and like how we use the phrase "I'm complete," and, you know, learning like virtual etiquette so that we're more effective and don't, you know, waste our time or things like that.
And some things in the chat box, the "we've always done it that way" mindset, the social distance guidelines, worried about community participation, but the turnout was great, and that was pre-COVID. Miss being able to read body language. Great participation with partners and community engagement initially was great. Since COVID, finding new ways to establish trust and safety with community to continue healthcare.
Lots of things to take into consideration. So when you're in these planning events, where did you feel like you were kind of all on the same page? At what step of the game did you kind of feel, or the planning process, did you feel like people were all on the same page? Maybe never?
Identifying a need, we have in the chat.
Jennifer.
So that's something I also think my executive team or admin council here at the hospital, I feel like we leave meetings thinking we are all on the same page, and then we go out and we start doing our thing, and then realize we are not even close to being on the same page with things. And so I think it's funny that you say that, because when you think you're on it, and you know, there's a lot of times that I think a lot of us think we're on the same page, and then we start going and it's like, what the heck just happened? So how do you know?
Well, hopefully we can find that out. When you think about these planning processes, where do you think maybe, or how easy, where do you think people might be feeling left out?
I'd like to do this one, because this is something that is difficult with some things, because when you have some people that have been involved for a long time, and then of course you want to cultivate new participation and succession planning and different things like that, there is a kind of like a seniority courtesy that's there, but new ideas are needed. So you have to be able to make sure that each voice is heard. That's one thing I've liked, and I have learned through some of these facilitated meetings that we've had through this process, is how to make sure, you know, you don't want to call out somebody and make them feel uncomfortable, but you want to make sure that everybody has an opportunity to be heard, and that you're able to kind of mitigate some of those really strong personalities to make sure that everyone feels a part, and not just like one or two people are railroading everything down their throat. And that's touchy, because sometimes it's your It's it's people that you don't want to shush, but you've got to make sure that everybody can be heard.
We also are getting into the chat box here, when we talked about challenges and not able to relate to others' difficulties when they've never struggled.
Yeah, so other times where people maybe feel left out.
I see Trish was trying to talk.
Oh, I was looking for how to raise my hands. I think I agree with her. That's one thing I also learned from doing all these meetings. Like I usually go around the room and just say, does anyone have anything else to add or say before we round up? And then I just, if I notice someone hasn't said anything throughout the meeting, I call on the person and say, did you have anything to say? And I just go around the room and make sure everyone says something before we round up the meeting. Yeah. And I'm complete.
Thank you. So when you think about kind of what we've talked about in a very short conversation here, what is something you're hoping to learn through today's planning process? And you can use your voice or you can type it in your chat pod, but what are you hoping to get out of this process today? What will make this time valuable for you? You just raise your hand in your screen if you want to, or unmute if you want to use your voice. Christian.
Okay, it's not to sound really rude, but to kind of be more of a voice, to be a bigger voice. As a community champion, this is our first year doing it. So I would like to have more of a bigger voice, maybe by learning how to action plan and to work with my other teams. It'll allow me to have a bigger presence, maybe, where they'll be able to kind of hear what we need and how to work with me. And like someone put, how to engage with everyone, because like we were saying earlier, it's kind of hard to relate to those that have been in these positions before we got here. So it's kind of like they know, like they have their little, you know, this is how we've always done it type thing. So I'm hoping that I can bring about like a bigger voice with some new ideas and to kind of like listen to everyone at the same time, but just to kind of be that more of a presence. I don't want to just be a community champion that just doesn't say anything and then, you know, they just run over, you know, forget that I'm there, you know, because my position may not be as big as everyone else's, but it's just as important, you know, because you still want us to be that bridge that connects us to the community. So that's what that's what you hired me to do, to be that bridge in the community. But if you're not hearing me, then we can't work together. You know, we're going to bump heads and we're going to be on 3 different pages. So I just think that this will help me to have a bigger voice, a bigger presence whenever we're action planning. And that way I can kind of, how can I say it? Kind of give them constructive criticism, but not sound bossy, I guess you want to say, to where they can understand this is what our community needs and this is how we can get it done. And I'm complete.
Thank you. Jennifer.
Sorry, I keep talking. But towards the end, because I was getting ready to say, I kind of went the opposite of what Christian is saying, in that I need to pull myself in a little bit and be able to, you know, to engage and encourage other people to participate, and maybe give some autonomy and some ownership over some of the stuff so they want to be involved in it. So that's what I want to learn.
All right, and
Yeah,
you can hear
Yes, I'm in the chat box here, how to motivate people to take ownership and action steps without seeming harpy, how to keep everyone engaged, how to get more people engaged, engaging the community, keeping everyone engaged, not losing steam over time, and then calmer presence and seen as the overachiever, not being seen as the overachiever. My excitement sometimes shines through too much. A fine line between part of the team and not over inserting myself into the action.
Perfect. All right. Well, you guys can let us know how we do by tomorrow afternoon. I'll ask David to go to the next slide there. The tool that we're working with today is really designed for smaller teams. So it is a template, as Carrie shared with us, that works great with teams of 10 or less. You can use it and, you know, push it up to 12 or 15, but it is designed for those smaller project teams. And through this today, you're going to have an opportunity to practice. So similar to our other trainings, we will explain, you will get an opportunity to practice. So we will actually be able to use some of your real events today, and Carrie will take us through that in a few minutes. So you guys can think about where you might have an idea. We'll be able to pick 3 of them that we can work through today. So it won't be a complete plan, but we can really get you started on what it could look like for you. And so we'll get half of that planning today, and you're going to see how we use those templates and how it will help to do some of those things that you're just talking about. How do you write it down? How do you get a group? How do you know when to move forward and at what scope level the project plan is going to be successful, or maybe when it's been too big? So with that, I'll hand it over to Carrie.
Yeah, so we're gonna start first before we get into planning. I talked about this earlier. We really need to kind of decide, is a project ready to go into planning? So for that, we're gonna go through, Angie's gonna explain kind of the 4 Ds, how to kind of start to scope a project, see if we're ready to go there. But first we need a couple of topics. So if who has a topic of an action plan that you would like to try out with us today and tomorrow? We're gonna need 3 of them. So go ahead and either put it in the chat or raise your hand, but let's look and see what we have, and let's pick a couple. So that probably will be the easiest. So if you have something you want to think about planning, it could be work related, it could be something outside of work, family event. So we have a community awareness campaign, internal project, mental health for our staff, telehealth in schools, community wellness and prevention, mental health awareness for community. We have a couple of mental health, a community wellness, 3 mental healths, telehealth in prison. So let's pick 3 and just scope it out and see what might happen. If we went to mental health, looks like that's probably one for sure that we've got going on, awareness. Anybody else of looking at those who wants to advocate for another one? Looks like telehealth.
Yeah, telehealth. I think we're all kind of going to be dealing with telehealth.
All right, so let's do community awareness, telehealth, and mental health. And so these are kind of broad topics. We're going to take them into going through the 4 Ds with Angie, and then we'll decide how we take those from there. So go ahead, Angie.
All right, so 4 Ds, what is that about? If you guys have your handbook printed out or available to you, this is actually going to be defined. These definitions I'm going to tell you about on the next slide, Dave, are here on the first page of your handbook. So the first thing that we look at before you scope out a project, it's important that you have the right process. Not everything's going to fit this process. And if it's going to be bigger than what we are tailing it to be, then we maybe need to look at a bigger planning process. But this allows us, the 4 Ds kind of allows us to test it to see if it's right. So the very first thing, is it doable? Is this a tangible project or event? Is it possible to do within the time frame? And the time frame we're looking at in this particular planning process is not strategic planning. We're not looking at 2 to 5 years. We're looking at over the next 6 months, 3 months, 6 months, a year, a short period of time relatively. Defined. So has the group have a general understanding of what really needs to be done, the results that are needed? If you are having a discussion that you're going one direction with telehealth or the other direction with telehealth, you need to do a plan to get your doctors on board, or you need a plan to be able to get your, the people using the telehealth. You need to have it defined before you go into the planning session. So there's some things that need to be scoped out there before you actually can go into the planning. Discrete. Is it separate and distinct? Can it be considered individually and not connected to something else? Is it part of a bigger picture of a bigger plan? Or can it be pulled out and be done as its own unique plan that needs to be launched? And the final one is decided. Is the group already decided that this project should happen, the event should happen? So it is, if it's a launch of a telehealth program, and we know that we're going to have to put some resources into it and really make it happen, should it happen? So if you can say yes to all those things, then you're ready to go into that planning. But we still need to step back and maybe refine the topic before we go forward. So there's another thing that we will do with that. But we will be opening up we'll be putting a Google Doc on the next slide. We're going to determine which one of these that you want to test on the 4Ds. So we will put the 4Ds in the 4Ds that we have identified. Are we having them on the slide, folks? Is that what we have? I started putting them in there. Make sure they get there. We'll be putting you in breakout rooms, and then as a small group, you're going to test these 4Ds, making sure that it's doable. You're going to make sure that it's defined, make sure that it's discrete enough. If it's too big of a project, then this isn't the right process for it. And then is it decided? All right.
So actually, Dave, if you could go back to the next project so they can sign up, go back to the PowerPoint and they can sign up which one they want to scope.
The next slide, he's got them there.
Oh, my pictures are covering my slides. I don't know what happened.
Yeah, he's got them there. So what we're going to do is go ahead and have you annotate. Is that what we're using? So we're going to have you annotate your name into, are we using annotate or the chat? It says the chat. We do both.
Pick.
You guys want to try annotate? That's what we've been doing. It's kind of fun. It's interactive. We'll give you another way to engage folks. So we'll see how it goes. We're going to go up to where it says you're viewing David's screen. Under view options, there's the annotate. And then under annotate, you'll see T for text. Find that. And which one of these do you want to discuss in a small group? So go ahead and type your name in there. We got some names coming in. And if you can't find that, go ahead and just put them in the chat and we will grab them from the chat as well. Making Dave earn his keep here. He's moving things around for you.
This is Geneva. I'm having trouble getting into that. I'm using an iPad. Where am I finding this?
It might be harder to use on an iPad, Geneva, so maybe just type where you'd like to spend your time in chat. Might be easier for you.
Okay.
Or you can tell us and we can put you in here.
Let's go ahead and do telehealth and y'all just put me in, okay?
Right.
I've had to run to the hospital and back, and I mean, everything has been just messed up.
No worries. And you want telehealth, Geneva?
I'm sorry now. Yes, telehealth.
Geneva, this is Mary. I have an iPad also. In the left lower corner, it has a David's screen on it. If you tap on that, it'll give you those options.
Oh, thank you.
You're welcome.
I am so computer illiterate. I'm working on it.
This is your opportunity to practice.
Okay.
That's Deborah and Brandy in the chat as well.
So then we're going to be putting you into breakout rooms, and we'll have you go into the Google Doc and you'll scroll until you see your topic area that you've signed up for. And as a small group, just ask yourselves the questions that are related to the 4Ds.
Just a moment. When you said go in, this is Geneva again, to Google Doc. Where am I supposed to find that?
We will be putting it into the chat pod. Are you able to access the chat pod? Have we done it yet? I don't know. I haven't seen that. My team.
I don't see a chat pod.
The Google Doc is in the chat pod. And so when you, on your iPad, do you have a bar that gives you participants and chat? It's a separate bar that would be at the bottom of your iPad when you hover over it.
Let's
This is
see.
Mary. On
Okay,
my
Mary.
iPad, it's in the top right corner. And
Okay.
there's 3 little dots and it says more. If you touch on that, you should get your chat box.
Okay, thank you.
You're welcome.
Thank you, Mary.
We're gonna have to start doing an iPad just so we can instruct. Mary, you're awesome. Thank you.
Yeah. Before you move on, Angie, we've got quite a few people on that mental health. Is there anybody that would be willing to go down to the community wellness and prevention? That maybe that would be your second choice and you'd be willing to go down and work with that team so we get a little bit bigger team there? Mallory says and Amy says. So Dave, if you could move Mallory and Amy down to, thank you. Round up our teams. Okay, Angie.
Okay, so we're going to be put into 3 breakout rooms where you're going to be joined with Carrie, Stephanie, and I. And when we go in there, we're going to be answering those 4D questions.
All right. Well,
And so Stephanie, you're going to be working with telehealth. Carrie will be working with mental health, and I'll take the community and wellness and prevention folks.
all right. So
Let's
if
give
everybody,
Dave some time to get these set up here.
yeah, it'll take just a moment there. So does everybody have were you able to access the Google Doc? Google Doc. So let's go ahead and get in there and you'll see if you know which group you are, and you can see the topics there. So you can scroll down to your topic area.
Wait, just a minute. This is Geneva again. I'm not in Google Doc. I know y'all are breathing heavy. Get it.
No worries, Geneva. When we go in there,
Control
if
Z.
you can keep your Zoom call open, you can participate because we'll be sharing the screen too. So don't let this bother you if you can't get in there right now. It's kind of tough sometimes on an iPad, so we got you covered.
Okay. I heard someone sigh.
That might have been Dave trying to put all these
Oh.
breakout rooms up together quickly.
It was a male sigh.
Yeah, no, it was Dave getting rid of the whole annotate screen and thinking he'd lost it for a quick second there. And
I was married for 38 years and I heard those sighs for my husband when he was alive.
No.
Sorry for the flashback real quick.
Okay.
And I just I'll just reiterate why this is important when you're going into your planning process, because sometimes you get going on something that is going to be so complex that you'll get started in this 2-hour process. And then it's all of a sudden it's like, wait a minute, this is too much for this group to plan. So we really want to scope it out and make sure that, we are headed in the right direction. So that's why it's important to do this. And really going into any project, and you may find out that it is needed a different type of planning process. It may be more strategic that you need, which is a whole nother level of complexity. Or perhaps you can just pull out some of the information. So we'll go ahead and put the Google Doc back in there.
We've got it in there. I just dropped it back in.
And it just went away again.
So if you open your Google Doc, if you open the chat pod back up, you should see it. I just posted the link again. So Dave's working as fast as he can here. We had him moving around the slides. Now we have him setting up breakout rooms. It's all fun.
But
There it is. How about that?
just another little tip you might be finding from the facilitation standpoint, using a slide deck and the annotate. We've been using annotate a lot lately. It gets complicated in the chat if you ask people to sign up for something, but you can see how easy it is to see where people stand on something. You might have them vote. You could put a Likert scale out here and just use one of those symbols to see where the people are standing on an issue. Not at all or totally in, and you could just put a heart on a scale. So there's a lot of things you can do within the annotate as well. So just a little tip while we're waiting for Dave to come around for us.
Yep,
Yeah,
and
this
then,
is a list that we've been doing that a lot in our center, too, in our staff meetings, and it works real slick. And Robbie and I have been working on some process improvements to remember to capture the picture for notes and stuff too, because the annotation can go away too. So that's my thing that I learned the hard way, is to capture the picture for notes and
now
afterwards.
it does allow you to save it. And
Oh,
the
it
option,
does. Okay.
Yep. So they've updated it so you can save it, because there must have been enough of us having that same issue. So that's a cool thing that it allows you to do too. And we've been putting up just a blank slide and allowing people to use it as a whiteboard as well. So there's just a lot of options there.
Yeah. Well, that's great. I'll have to check into that.
Yep, it's just right there beside the closeout, the annotate. That's the other thing. If you aren't familiar with this, you have to X the annotate. Otherwise, everything you touch on your screen will show up on our screen. So once you're done doing your name.
looks like we're ready to go, Angie. So 5 minutes in the breakout room to scope out our projects. So what we have a very large topic here. So when you think about telehealth, what within telehealth, if we're thinking about, is it doable in a year? What is that?
Alyssa and Selena,
Feel for you? What around
did you want to go in
about?
to these, or did you want to stay out? Okay.
I'll stay out.
Okay.
I don't think I'm in one. A project that would be with
Carrie's not in the group.
I can hear them talking, but I see y'all.
That's Stephanie and I are in the same room, so let me see. Which one were you supposed to be in, Carrie?
I'm not sure.
What group did you sign up for?
I don't see her on the
I
screen.
don't see Carrie. Carrie, would you like to work with telehealth, mental health, or the community wellness and prevention group?
Let's go telehealth, since that's a big project we're working on too here.
And Brandy isn't in a group either, it looks like.
Okay, so Carrie wants to go to telehealth, and that was on group, looks like
Group A.
1, group A.
Mm-hmm.
All right, send Carrie there.
And I see Brandy is listed as mental health for right now. She needs to get sent to that room.
Okay, Carrie, you're going away. You should see a join button. Okay. And Brandy was in which room?
Mental health.
Mental health. All right.
Group
And
B.
Thank you for
I
your
see
help, everybody.
Deborah is telehealth group A.
Deborah. She has clicked the, all right.
And Geneva is also telehealth.
Jackie, did you have a group that you wanted to join?
Telehealth.
Telehealth?
Yes. You want to go to telehealth? Okay. All right, so Geneva, are you with me?
Yes.
On the bottom of your screen, there should be a join button. If you click that join, it should get you into the room.
I'm in the room. Am I not?
You're in the main room with
No,
me and
just a minute. I've got something on history. Okay, I'm in Doc's telehealth.google.com, and in that I'm in topic 1, the telehealth room, and I'm in and I see those 4 things. So what do I need now? Where do I need to go now?
You need to go back to your Zoom screen with everybody's photo on it. And then down at the bottom of the bar, there should be an option to join room. Then you just click on that join and it should take you right to the room.
All right.
There we go.
Thanks, David.
It's all good. we roll with challenges all day, every day.
I know though, when you're producing, you want to get people where they're going as soon as possible.
Yeah, especially when the time is, so short.
I feel that, David.
The best part is when you can just roll with the punches and the group allows you to do that, right?
Yeah.
So that's even better yet.
This is a perfect group for that.
Geneva, you're back in the main room.
Yes. Should I
Did you-
not be in the main room?
No, you should still be in your breakout room. Did you exit your breakout room?
Yes, I thought we were. It said exit now or in 60 seconds, so I went ahead and exited.
Yeah, they're closing up real fast here. There's probably a good chance they're going to want to extend the time. We'll see what they want to do.
Okay, so you want me to go back into the breakout room?
No, you can hang out here. It's going to close in 16 seconds or less.
Okay. Okay. How do you get a Zoom app on your laptop? I just got a new laptop in last week, and I don't have the Zoom app on it.
You'll have to go to your app store.
Okay.
And then download you'll type in Zoom and you'll want
Okay.
to download the one for your iPad.
Okay, and in the alphabetical order, I don't see an app store.
It'll be the one that it'll look like a big A in a box.
Okay. Access?
Oh,
Is
Do you
Well,
see
Jan-
my phone? Can you see the A there on my phone?
Yes. I
That's
don't
what it's
see
gonna
it.
look like. This blue right there.
Well, I have that on my iPad and my iPhone,
Is
but
it-
I don't have it on my laptop.
Is that an iPad or is that a different?
Well, here's what I'm doing.
Is
I'm
it a tablet?
on my iPad. I'm trying to get the Zoom on my laptop computer at the same time while we had a minute.
You go to the Zoom site, don't you? And you just download it from there.
I tell you what I'm going to do. I'm just going to search for Zoom.
David, is it possible for you to take Geneva into a breakout room and maybe walk her through some of those things?
yeah.
And then Stephanie, if you wouldn't mind showing the Google Doc, we'll.
Stop sharing.
Is that what we're doing, folks? So we can talk about what we have decided here? So telehealth, what did you decide? How did you determine the 4 Ds in your group? What were some of the key considerations?
does somebody from our group want to speak for us? What we kind of narrowed it down to? Leah, can we lean on you here?
Sure. Okay, so we decided for our telehealth, we're going to do an educational campaign. We defined it as educate the general public. It says, are we discreet? It says yes. We decide the timeline is 6 months, and considerations would be population not having internet services or actual devices or computers or laptops and then also our budget for our educational campaign. And I'm complete.
All right, thank you very much. So again, we look at the considerations and identify that what we need to do to make it work for the process. All right, moving on to the next one, Miss Carrie, your group.
Yeah, so we were in the middle of a conversation, and if somebody wants to talk, but we decided that the mental health topic was too big. So we went through this the first time, the questions, and they were all no. So then we narrowed the scope and came back and did it again. And so our second, if somebody wants to share what we decided. We didn't get all the way through it the second time.
I think we decided that we would do focus on employees' mental health and try to, with everything going on, try to improve their mental health house. With COVID, everything's slowed down, and where us smaller hospitals are not getting as much, we're just now getting the wrath of COVID. So we decided that we would try to do a mental health initiative for our employees. We didn't set a time though, like how long.
You'd definitely be something that you could do in the next 6 months to a year, though. That's part of this D, is identifying that it is not a 5-year plan. It needs to be done now. All right, so my group, we worked on community health and wellness. That's not a small topic, is it? What did we talk about there? I think I had, who did I have talking for me?
Me.
Oh, there you are. I was looking for you.
Like she said, community wellness and prevention is a big topic, so we narrowed it down to COVID awareness education initiative. This is something that can be done because the information is basically there. We looked at a timeline. We said 6 months, but then we were like, well, you could do it in less than 6 months because we have all of the information. It's just to kind of to repackage everything, to kind of re-educate everyone. Because it is a renewed sense of urgency since numbers are going up. It is discreet, as it is just focusing, just strictly on COVID. And we all agree that we decided that, it's something it needs to happen because we're all facing the same problem. And I'm done.
All right, awesome. So we can see that these are the things that you would do to make sure that you're lining yourself up with a project that is going to be worth everyone's time to get in before you get too far. So we'll go back to our PowerPoint slide. And Carrie, you want to talk about how we're signing up here?
I thought they were already signed up.
Okay, all right. I thought. All right, then we're good with that. I didn't know the difference between 9 and 11, I guess is what I was confused on. So we will go into the next slide, which is the, we are not done yet. Whoop, we're back one slide. So we actually, now that we've identified a plan that is doable, defined, discrete, and decided, we need to make sure that we have the right people in place. And this is another template that we use. And what we would do is determine that we have the right people on the team, or do we need to recruit other folks? And since this is you may or may not be necessarily using this document, or you might not have the same people that are doing this plan, we'll kind of walk through this based on the topics to save us a little bit of time here. Team, is that okay with you that we don't go into this document? Yeah. Or should we go in there? Stephanie, Carrie, I'm looking at you.
I think you can talk it through, and then when we go in, yeah, I think you can talk it through.
Okay, so really this particular document, and then it is on your page 2 of your handbook as well, and we just put it in the chat pod too, the Google Doc, so you have it there as well. So you want to identify who the team is, and there may be other people than what was in your small group doing the 4Ds that you need to pull in, and you identify that those are going to be important people to make this plan go forth. So you want to be able to recruit that. And there may be expertise that in particular, it might be someone that is a telemedicine expert that needs to be there to really talk about those things. clearly defining the why you are doing this plan is another thing that you want to do. What is the intent? What do you need to be identified at the end of this plan? What's the information that is needed to make this plan happen? And you'll see when we get into the actual template, a lot of this information is the givens. You may have some grant guidelines perhaps that are in here that says this is the why we need to do this. We're saying that we have to pay attention to our employee mental health issues. And it's part of, the XYZ grant. That might be something, and we're restricted to doing certain things. That might be something else. And in the end, the what is where we really want to get to. And once we're done with this plan, we'll know we're successful when we have what accomplished. It might be a new initiative that is launched to the communities around COVID to reinvigorate them, right? And then the very last thing is that you do is once you've decided that you have all those things in place, once we've scoped it out that way, we identify when we're going to actually go forth with the planning process. So we've tested it with the 4Ds. Yep, that's all there. We've looked at the people. And do we have them in place? Do we know why we're doing it? What we hope to accomplish out of it? If we have a discussion that we're not quite clear on something, we need to stop here. Because if it's not clear for the planning team, you're not going to be able to move forward into having them help build it. So we want to clarify it at this point. All right, so that moves us into, let's take a look at what our first steps are. So in your workbook, and this would be on, I think it's on page 5. I put page 5 in here, looking real quick. Actually, page 4. Nope, page 5. Page 4 is the rest of the scoping. Accelerated action planning, what it is and what it is not. Accelerated action planning that we're doing with this team action planning is all about doing a plan that can be done in a couple hours of time. Carrie and I would do this, like we're breaking this up for you all. We would do it in 2 1-hour lunch hours when we went out and worked with coalitions. So we would do the first part that we're going through today with them, and then we come back and do the second part. So the lighter blue would be the first part that we would work through. And then we would come back and do the second part with them over the second lunch hour. And so this model is really broken into 3 templates that walk you through these 8 processes. It is designed to have a small team. So again, if you've got a bigger group of people, you're not going to want to use this process. We're talking like 4 to 8 people, no more than 8 people. Any more than that, it gets crowded. And so you want to be able to make sure that is available to you. And the first 4 steps are really about developing an appreciation and understanding of the project. So what we just talked through and that scoping piece of it is a lot of things that go into that getting started in the givens. We know who's in place. We know what we're hoping to accomplish. This is a lot of you in your opening were talking about, I really want to have my voice in there. I want to be able to make sure that I'm guiding the process. It is here that you as the coordinator of this plan get to state what is needing to be accomplished. This is non-negotiable arena. The number 1 is where everything that goes into here that we need to take in consideration is taking place there. The next thing is looking at the success and victory. So we look at the things, if this plan is successful, what is happening? So we take a time frame. I'll go with our group after a COVID launch. We have everyone talking about the campaign. We are seeing billboards across the city. So you envision the actual plan in place. And then we look at the current reality. And the current reality is bringing us back to landing into where we're at. And then we are saying, okay, but this is what we got to work with. And this is what the scope of the project is about. So we'll look at each of these a little bit more. And then after we go through that, we really say, okay, based on all that information that we just worked through as a team, what are we saying we're really committed to getting done? And then we'll look at the rest of the process later, but those first 4 are what we're going to focus on today. All right. So the first template that we have has these first 4 steps in it. And as I was saying, the number 1 is the givens. What have we accomplished to date? Like in my group, we already said we have a host of information around the COVID issue that we just need to repackage and redo. Time frame, you may say that that's going to be in the next 3 months. What else is known about this project? So, you know, you might put some statistics in there. You might put some of those grant goals in there. And then, so those are the things that you have a chance to put your words into there. And then the success and the victory, number 2, is really, what do you see in place? What has been done? So you imagine this after the date that you said you'll have this plan complete. So it's the day after it's complete. In the case of our group that's doing the COVID launch, so you imagine that the campaign has launched. What are you hearing people say? What are some of the headlines that the newspapers are covering? What are you remembering about the process that as you built this campaign? You just go into what's in place, what are people saying, what is different as a result of this. But once we get done with that, so that's very success, right? We think of the very great success. We think about then the current reality. And this is about the team at first. The first 2 things look at the people that we've gathered to do this plan. What are the strengths that this team brings? Again, going through my groups, you know, you might say as a strength of the team is that we have some people with some creative marketing skills, or we might have some access to resources that we can do the campaign in, or whatever it is. But weaknesses, you know, you might identify some things that the team just they don't have it there, or they may be overburdened with other things. And there may be things that we just need to consider with our current reality. Then the last 2 questions are about the project. So thinking about the project that we have in mind, what are the benefits a success will bring? So if we launch this COVID awareness campaign, what are we really going to see a difference in the community? What are the benefits of doing this? And then the last one is, we think it's highly successful. So put in the mindset that we've knocked it out of the park. What are the dangers or obstacles that we may anticipate confronting if we're highly successful? What are the things that we may encounter? So in the case of our COVID awareness, maybe the hospital is going to come to us for every media campaign thereafter, and we're going to be the ones to be turned to for that. Or we may get national attention, and it may take additional time from our already busy schedule. Think crazy, out of the side of the box, so that we actually are working on a plan that may conquer some of those things. All right. Then once we get done with that, we look at the commitment. And the commitment is where we really help people identify what they're collectively ready to do. And so this is where I turn it over to Carrie.
I was gonna say, go ahead and keep going.
Okay, I can do that. I just was seeing that I was supposed to have it to you. So really what the commitment does is you go back through and you read through that victory. So you have someone really paint that story of what we said the victory looked like. So with the number 2, what did we really see in place? And then how are we considering the things that we are as a team? And then it's really talking about what we are grounded in our reality, what we can possibly do, thinking through that. What are we going to do as a commitment? So you put some ideas out of this, and it's really broad ideas that we're going to have a media campaign that reaches, the whole community, or it's going to be targeted at a certain audience. Just keeping going down that thing. So scoping it into an overall bucket that you can really put some actions to. This isn't where you're going to put in the actual actions. We're going to get to that in step 5, but here it's just really the line of work that we're really committed to doing, and then we'll figure out the details later. And so then once we are done with that, then we can move into really teasing out what the key things are that we need to do to make those commitments come to life. So once we get done with our break, we are going to come back, and then we will actually get you into those groups, and we'll walk through these. And so you will be coached by Carrie, Stephanie, and I to do it. And like we said, it's a self-directed thing. So we gave you a quick overview of all the steps, but actually doing it is where you're going to learn it. So we will honor you with a 10-minute break here. And so that means that 30 minutes after the hour, we will come back here and we'll get started with doing some planning.
All right, so you can turn your videos off, or if you want, go to step away from your computers, get a quick drink, and we'll see you back shortly. If you can hear my voice, go ahead and come back in. And we are going to spend the next, 25 minutes, I believe, in our breakout rooms. We're going to spend just a couple of quick minutes going through that first template, that scoping template that Angie ran through. So we'll spend just a couple of quick minutes there, and then we'll spend the remainder of that 25 minutes working through steps 1 through 4. Angie, Carrie, anything I missed that you want to add?
Nope.
All right, we will, we can re-add the links if you don't have them when we get into our breakout rooms. So we'll just have Dave put us in breakout rooms, and we'll take everything else from there.
I can do that.
All right, so we've done a lot of work, got through most of our steps. Hopefully you had some time to kind of see how this template works, and we really kind of helped guide you through that. You've hopefully put down some tasks that need to happen. So when we come back tomorrow, what we're going to do is we're going to take those tasks, we're going to put them on a calendar, and we're going to lay it out, and we're going to look at the calendar as a whole, and then do some coordination in between committees. So what you've done right now is just taken some tasks that need to be done, naturally forming committees of who's going to be doing what task. We'll come back tomorrow. We're going to decide when those tasks are going to be done, again, and then looking at it as a whole. So first of all, let's just take just a moment and to say, who has a question? We kind of went through this pretty fast, but who has a question that's kind of been lingering about the process that we've gone so far, that you still feel like you need to know before we can close out? No questions. Great job, trainer team. Fabulous. All right. So let's just do a go around and hear from everybody. What is one word that comes to mind when you think back of what we've done here today, just this morning? So we're going to start with Alyssa, and then Mary, and then Geneva. What is one word that's just coming to mind when you're reflecting on our work together today?
Well, I always enjoy seeing everyone here today from kind of my center hat, but I also am enjoying being a fly on the wall, listening to what each of you are working on and doing and your questions have. So we can, Selena, Karin, and I can bring that back and update our work with you and keep that going forward. So I'm just from a listening mode today. So thank you.
Perfect. So one word to describe your experience here today. So Mary, Geneva, and Jennifer.
Okay, this is Mary. I would say engagement. I enjoyed seeing how you get people engaged in the discussion.
Perfect, thank you. Geneva, Jennifer, Leah, one word that describes what your experience today.
Brainstorming.
Perfect. Jennifer, Leah, Carrie.
Gonna steal Mary's engagement.
Lee, Carrie, Kelly.
Mine was successful collaboration.
Thank you. Carrie, Kelly, Selena. Selena with a C.
My word left me when you said my name.
I'm sorry.
It's because you worked all night last night.
It left me. Hopeful. That's what it was. Hopeful.
Thank you. Kelly, Selena, and Jessica.
I would say coordination.
I'm going to say collaboration as well.
Jessica, Trisha, and Karen.
I'm going to say teamwork.
Trisha, Karen, and Vicky. You're muted.
Brainstorming.
I already said that. It's
Well,
okay.
I'm saying it too.
Okay.
I'm going with teamwork as well. I'm stealing Jessica's.
Vicky, Mallory, Robbie.
Future.
Mallory, Robbie, Amy.
I'm going with brainstorming.
Robbie, Amy, Karen.
I'd say invigorating. I'm also a fly on the wall today, so it's been fun.
Amy, Karen, Christian.
I wrote down methodical. Just make a method out of it. So
Karen, Christian, Brandy.
Collaboration.
Right. Christian, Brandy, Jacqueline.
Knowledgeable.
Brandy, Jacqueline, Mary. Mary B. Brandy might have had to step away. You're on mute if you're there. Jacqueline, Mary B, and Deborah.
Brandy said productive if you did
Oh.
not see that.
Perfect. Thank you.
And it has been productive this morning.
Yes. Let's see. Where did we leave off? I see Deborah also has knowledgeable and collaboration in there. Mary B, do you have a voice?
Yeah, I already went.
Oh, yes, you have two.
I'm there,
people.
right.
That's right. Gina and then Selena. And Gina was having issues in the break room or in our small group. So Selena.
Informative.
Perfect. So anybody can answer this, but just thinking back, what was exciting to you? Where did you feel excited today? You can raise your hand or take yourself off mute. Selena.
I think every time we do these, I get like inspired to like do some sort of like activity that I didn't think of on my own or think something like that would work. That also helps me like pitch it to admin too, because I'm like, hey, like this worked for them. Like this is not impossible. People do this. So I think that always helps me when we have these sessions.
Thank you. For anybody else, where do you feel excited?
I felt excited thinking about how I can launch a new idea to the community, and whether or not, going through the positives and negatives of, maybe pitching this to the community, because we do not have this where that they can call in and have an office visit that's not been done.
Thank you. Jessica?
I just think hearing everyone's ideas and like Selena said, just hearing what everybody else is doing in their community. And then I wish that all of y'all was at my hospital to help me, because I feel like I'm lonely in this department.
See, I feel real lonely too. But at least you know how to do your computer, so you're ahead of me. And
but it gets annoying if you do know how to. My whole hospital, I feel like I'm the IT person. So,
well, I wish you were here to help me too.
All right, Christian and then Trisha.
I like the fact that the tool that we use today, how you can just go from so broad to so specific, and it was very easy, like to follow, So that was really, really cool. I mean, that's one positive that I have so far for today. So I look forward to tomorrow to see, how deep we could go with the next steps.
Thank you, Trisha.
And I was gonna say the same thing. I'm always excited to see what new tool we're gonna get to see and learn to use. And so I was really excited about learning about the new tool for doing this today.
Perfect. And we have in our chat here, I just moved it. Seeing thoughts, ideas written down, there are possibilities into reality. I'm excited about trying apple cider and red hots. Me too. And excited to be here. My first day back to work after 2 weeks of sick leave. So we're happy to have you here as well, Mary.
So Hugh Life team, if we look at the clock, we are an hour early.
What?
I know, it's kind of like, it's like we're winding everything up and it's not even 12 o'clock yet.
I'm hungry. I was really excited to see that this was happening.
I too, I thought I've got time to go to the Roundhouse for lunch.
I'm sleepy.
Somehow our math did not work. Our calendars are another hour, and our math on our slides did not match that.
Our multiple time zones is not working for us.
You know, I miss meetings with these multiple time zones, and I'm a teacher. And
so there's a couple of options we have today.
I'm confused because I thought it was 9 to 12.
look at your
it's
look at your calendar
it's supposed
invite.
to be 9 to 1. I thought.
It is. It's correct. It's correct on our calendar invites. It's just not correct on our timing. Our math was our timing and our math was off. So we have a couple of options. We got to a good point today. We are at a point where we can definitely finish up tomorrow. We are going to be able to add in some application time tomorrow. That will be no problem. But also people might be in the flow of things today. So if we want to go back into breakout rooms, we can certainly do that to keep the flow of today, or we can just pick this up where we left off tomorrow. Since we've got a few people excited about ending early today, I don't want to discourage that thought. But Selena, I'm going to let you make the call here on how you'd like to move forward. But we are in a good place with the tool. As far as being able to finish tomorrow, have time for questions as well as some application time.
A second. And before she says that, when I talked earlier about how Carrie and I would do this in a couple lunch hours, this is the point that we would stop after we got those key. We would either stop before we got to the key actions and brainstorming. We might come back and do the brainstorming, or if we had time over a lunch hour, we'd get them to those key actions and brainstorming the tasks before, and this is a natural break spot. So either at 4 or 5 is where we stop usually in our natural process of trying to divide this up in our small groups that we've worked with.
Yeah, Selena, choose wisely.
I know. I've been placed on
Selena, I'm getting hungry. And so I need
so since this does seem like a natural stopping spot, and it does seem like we have made a lot of progression today, I think it's best that we end here, and that way you guys can take care of any other tasks that you may need to do today so that we can be fully engaged tomorrow. No issues or excuses should prevent us from tomorrow being engaged. So we'll just stop here and just encourage you guys to show back tomorrow. It starts at 9, but strongly encourage you to log on 15 to 20 minutes prior to. We know that we had a few technical issues today, and we want to go ahead and address that as early as possible so that we can have enough time to receive the education and do some more application tomorrow in the breakout rooms.
So tomorrow, is it really 9 to noon or is it 9 to 1? Is it 3 hours or 4 hours?
It'll be 4. It'll be 9 to 1. And we will have a break. So if you guys want to put a snack in your fridge, you can, if you're hungry over this lunch hour, it won't be a problem. We'll probably be close to application activities at that point. So you can feel free to bring your lunch, or we'll have a break around that time where you can grab something if you've maybe pre-made it, and make it easy so that you're not hungry the whole time where we're here till 1. Sound like a plan?
Yes.
All right, fantastic. Well, you guys enjoy your extra hour today. Maybe, you know, an extra hour of rest or some work done. I hear there's some community champion work going on that you might be able to spend an hour working on. Thanks, everybody.